Looking after your health today gives you a better hope for tomorrow. Good evening and welcome. This is Face the Nation. Our topic of discussion today is battling COVID-19. Joining us this evening on the show are Professor Indika Karunatilaka, former president of the Sri Lanka Medical Association, as well as the Secretary General of the Asia Pacific Academic Consortium for Public Health. Also joining us tonight on the show is Dr. Rajiv De Silva, spokesperson of the Association of Medical Specialists, and also joining us this evening on Face the Nation tonight is Dr. Anwar Hamdani, Chief Coordinator of COVID-19 at the Ministry of Health, as well as the Director of Medical Technology Services. Let's start off tonight's show with Dr. Rajiv De Silva, spokesperson of the Association of Medical Specialists. Now, Dr. De Silva, when we speak about COVID-19, we're now talking about the Omicron variant. There's a notion in the general public that Omicron variant is a lesser devil than the Delta variant that was experienced a few months ago rapidly across Sri Lanka. How far is this notion true?
Well, if you look at the Omicron variant, the initial one, which now we can call as BA1, is certainly less dangerous than Delta. Right? The reason was that this particular variant multiplies in the respiratory tract and not in the alveoli, the air spaces of the lung. It doesn't multiply there mainly. So therefore, you can get infection and inflammation of the bronchi, the airways, but not pneumonia. It's much less. Now, there is a new variant called BA2, which is probably from the same Omicron, the parent strain. There is one study from Japan which says that it is more transmissible, about 30% more transmissible, and in animal studies it can affect the lung as well. Now, that has not been corroborated, that has not been peer-reviewed, that particular paper. So, while the Omicron that we know is definitely milder than the Delta variant, there is a possibility that this BA2, which is superseding BA1 in certain countries, may become more dangerous. We don't know.
So, Rajiv, the BA2 variant that you're talking about, has this been declared as a variant at present by the World Health Organization?
No, it is still the variant of concern is Omicron. So that particular paper suggests that BA2 also should be given a Greek letter, designated as a variant of concern. It is a variant of concern, but it is part of the Omicron.
Does that mean, Dr. Rajiva, that we can assume that Omicron BA2 can be as lethal as Delta going forward?
We don't know. Now, these are early days yet. This is just one paper, but of course it is coming from the University of Tokyo, which is a pretty famous university. So I think they are credible researchers. So at the moment, the situation is rather mixed in the sense, in the UK and South Africa, the BA2 variant is also present, but deaths are going down. Whereas in Denmark, where the BA2 variant is also present, deaths are going up. So we don't know. So it is possible that the BA2, I mean, there are a lot of amino acid mutations between BA1 and BA2. And there are certain other things, you know, the cells that are infected, they form what are called syncytia, multi-cellular groups where you get a lot of BA2 being produced. So there is a possibility that this may be more dangerous than BA1. So at the moment we are not sure.
Dr. Rajiv, I want to get back with the numbers with regard to the vaccination drive in Sri Lanka. But beforehand, appraise us with regard to the vaccination drive in a country like Israel, which is in the forefront, which has already given the 2 booster shots, that is including of the 2 preliminary vaccination drives that took place in across the world, that is the first, second, third shot as well as the 4th shot. how successful has Israel been thus far with regard to combating or battling COVID-19 is concerned? Can they be taken as an example moving forward?
Well, if you look at Israel, they gave Pfizer 2 doses, then they gave the 3rd dose. They were, I think, one of the first countries to give a 3rd booster. And now people over 60s are being given actually the 2nd dose, that is 2nd booster, that's a 4th dose. However, cases are going up in Israel, but the deaths are down. So that's the important thing. Now, it's possible that the booster, the 2nd booster or the 4th dose would probably reduce disease, clinical disease and death. So, but we don't know a lot about what is happening with Omicron or with all the variants. In the sense that certain countries with a lot of vaccination, the case load is going up, whereas certain other countries where the vaccination is less, you don't get that many cases. So there are a lot of other things also involved. For example, South Africa versus Iran. Iran has a lot of Omicron, but South Africa, you don't get that much now. So basically, there is a genetic part to play, and certain of the vaccines that we have been given in the past, like BCG, maybe, or the infections that we have faced in the past, may also change the way a particular country deals with Omicron or with the coronavirus.
So
there are a lot of things we don't know.
Dr. Rajiv, going forward, what is the alternative? Does that mean that we have to live with the vaccination provided by the major players right now in the market, like Pfizer or AstraZeneca or Johnson & Johnson or Sinopharm or Sinovac? Or must we rely on these booster shots going forward, or must there be a new vaccination that comes to play to combat all these problems? Don't you think the attention should be focused on something like this, and that is the need of the hour?
Yeah, can I explain about the vaccines?
Yeah.
So basically, the vaccines and infections, they activate the immune system in 2 ways. They produce antibodies and they produce what are called T cells. Now the antibodies, they prevent infection and they prevent clinical disease, whereas T cells, when a virus gets into a cell, the T cell destroys the cell. So with T cells, you do not get severe disease or you don't die. Now the problem with the antibody is that the part of the virus that the antibody recognizes has changed, particularly with Omicron or the Delta variant, right? So it's very difficult with the current vaccines to get sustained protection against clinical disease. So you give a booster, for some time you will, the person will not get clinical disease, but that is only for a short period, because the antibody, as I said, basically recognizes changeable parts of the virus, but the T cell responses seem to be constant. So with the vaccination, you probably will get some sustained immunity against severe disease or death, whereas the response or the protection against clinical disease will wane with time. So you can't go and give boosters continuously, right? So you need another vaccine now with the Omicron that directly focuses on Omicron. So now there are I think certain Western firms which are doing studies or clinical trials on Omicron variant vaccines. However, every time the variant changes, you can't go on producing vaccines. So what will happen is, this virus will be there for a long time. It will be like the flu vaccine. But because of the vaccines that we have been taking, and also because of infection, we will have protection against severe disease and death, but we will definitely be getting things like colds and fever. and this will be going on for a long, long time.
Right. So the alternative is to make sure to get what you said correctly, Dr. Rajeva. So the way to move forward, or the way forward in this front, is to develop a new vaccine that combats all these variants in the future, which would be a long-standing effect on individuals in the future.
Plus, taking the booster now.
Right. Okay. Right. Thank you very much, Dr. Rajiv De Silva, spokesperson of the Association of Medical Specialists. I now move my attention to Dr. Anwar Hamdani, Chief Coordinator of COVID-19 at the Ministry of Health, Director of Medical Technology Services. Dr. Hamdani, welcome to Face the Nation. This is your first time being featured on the show. Nice to have you on board today on FTN. Dr. Hamdani, Dr. Rajiva spoke very eloquently about the need to get the booster shot. But when you look at the numbers in Sri Lanka, it is very, very poor. Look at the numbers. The first dose, 16.8 million got the dose. Second dose was 14.082 million. Third dose, only 6.48 million, which is approximately 46% of the success rate as far as the third dose is concerned. Now, if the third dose is supposed to bring down the number of fatalities in the future, reduce severe disease and death, as Dr. Rajiva did mention before, why is it that people are shying away from taking the third shot?
Exactly. A very good inceptive note, Shamir. Let me start with a graph of it. So if we can get a close up.
Yes, we can see that, the doctor, yes. Yeah.
Okay. So this is where the death's all about. So this keep on rising. When we had the vaccination coverage for about 31%. So when we reach this 46%, you see the falling of deaths. But still, as what you very correctly mentioned, there have been people not coming forward. I mean, we've been offering this for a while. From December, we've been offering this. For the past 2.5 months, roughly about 2 to 2.5 months, we've only reached 46%. There has been a lot of misconception, a lot of misinformation. Rather, I call it as disinformation. There's a very big difference between misinformation and disinformation. So there have been people who do not realize the value of their life. So we've been coming out to say, so the third jab, the third shot was actually decided on a scientific basis. Dr. Rajiv would elaborate very much on that, I suppose. That he very clearly mentioned why it is needed and what is the way forward also. So, but after telling all those things, still there had been a very little support from the general public over it because of so much of misinformation and disinformation. But one should understand, you actually can postpone your booster jab. You actually can postpone your booster jab because you know, okay, fine, you think, okay, fine, you can get it tomorrow, the day after, after a week. You would not know how much of time you have. You would not know what complications you are running through. I'll get you a very good example. Take the best example would be me. I do not know what I have. I have a flu. I go and get myself tested. Fine, I'm tested positive. Within the factor of getting tested positive, I tend to do my other test. Then only I realize I have, so much of other comorbid diseases such as diabetes or hypertension, etc., where I do not know anything about it. So I have not got my jab. So I run through this phase and I fall into trouble. Without knowingly, you fall into trouble. But what we know is the fact of the matter, we have provided the public with the necessary vaccines, and centers are open, island-wide, and we even gone into an extent of, providing mobile services, which hardly other countries do. So even gone into that extent because we know, we have experienced this, Shamir, like take it on the first phase, take it on the second phase, the third phase. The third phase, the health system was challenged. We went into a crisis. Health system was challenged. It was overwhelmed. And the health workers were overwhelmed actually with work, because everything has a capacity of it. Take a country, take an individual, take an institution which has a capacity. When the capacity is challenged, it shakes a bit.
So, Dr. Hamdan, you speak about misinformation that is going across the board. If you look at the social media today, there are many information saying if you take the third boost shot, you may fall into trouble, you may not be able to have kids in the future. A lot of misinformation that is running across the board. But what is the responsibility of a government in a situation like that? Aren't they supposed to counter these allegations through a proper social media campaign, maybe a long-standing campaign on television or radio? Isn't this the way forward to counter and battle it out as far as this is concerned, or probably even make it mandatory for individuals to go out? If not having the third boost shot, they can't even go out. Now, that is a system that is being adopted in a country like Dubai as well through an app. But in Sri Lanka, we are far from it.
Shamir, see, it's an individual right. Let me put it in this way. To take the jab or not is an individual's right. So you can decide on your life. You can decide on your life course. You can decide on your risk course. But you have no rights to put the other people into risk. As a responsible citizen, as a responsible individual, you should hold your rights properly while maintaining other people's freedom, other people's liberty, not alarming or harming them.
Yeah, let's forget about responsibility of individuals, Dr. Hamdani, because if you look at the political hierarchy in Sri Lanka, it's absolutely pointless talking about responsibility, because even the political hierarchy in the country are not taking responsibility for their actions in today's day and age. But how do you boil this down to the public, for the public to know? Now, I will tell you a classic example. Individuals in the recent past who probably got the flu may have thought that they are not infected with COVID-19, but they have just got the cough and the flu or whatever which was spreading at that time in Sri Lanka. And as a result of that, they go out. They're up and about. They don't even stay in quarantine for 7 or 10 days. They go through that period and then they go out and, probably infect someone else. What is the danger that people pose to the society at large if they do not get the third vaccination shot?
Exactly, Shamir. Like, see, in the past few weeks, we were running up with a flu, general flu. But, so, as what you said, people might think, okay, fine, we have a flu and they might be, carrying out their normal day-to-day events.
But it may be COVID.
It may be. Unless you're tested positive, one can argue over the matter, telling that, no, I was not tested positive, so I'm just normal with it. But you run through a couple of days, you know it for a fact that what are the difficulties you're just facing, your body is facing all about. So,
no, but Dr.
So why don't we
just get a mild cold or mild flu?
Fine, still.
So you would know whether it's COVID.
Okay, fine. Let me take it on another day, on a normal scenario where this COVID is not in the picture. Fine, you take it as a mild viral flu and you carry on your duties and take medicines and go away. But now, as of now, we are facing a global pandemic situation. This is not a normal situation we're facing around. So it has not gone off, like what Dr. Rajiv very well said. This has not been eliminated from the world yet. So if you have something like that, why don't you test yourself? You can obviously get yourself tested. I think Professor Indika over the weekend made a nice article over that. Just don't claim yourself that you have a viral flu and roam around and spread it around. So it's kind of Shamir, take it like this.
Yeah.
You have a viral flu. Very well. Will you carry your daughter or son? Will you mingle up with them? You know why you don't do that? Because you love them. You don't mind you getting infected with a viral flu or anything else. You don't want your children to get infected.
Yeah, but Dr. Hamdani, there are many issues in the government mechanism as well, when we speak about getting tested. Now, let's say take Shehan or Hassan who wants to get themselves tested. Unfortunately, they have to go to a state sector hospital or a private hospital to get the antigen kits. They can't buy it over the counter like in Dubai or US or Australia or any other country in the world. They can't buy an antigen kit through a counter. And you remember 1.5 weeks ago, there were a dearth of antigen kits even at hospitals, apart from the rapid antigen kit at the Katnaik International Airport for PCR tests. And the PCR test cost 7,500 rupees in the private sector. And the antigen kits itself cost 2,000 rupees. Given today's cost of living, Dr. Hamdani, is it practical for us to go and tell the public to go ahead and take an antigen kit and do a PCR test when it's not even available at times?
Thank you very much for that question, Shamir. Actually, I think I should be coming out with, like, in Colombo, in Campbell Park, daily from morning 9 till 1400 hours, 2 p.m. in the afternoon. You can go, if Shehan wants, if Shamir wants, you can go there and get yourself tested. Likewise, we
Free of charge?
Free of charge.
Where is the location, Dr. Hamdan?
Campbell Park.
Campbell Park. That is between what time and what time?
From 9 a.m. to 1400 hours.
Okay, that's until 2 p.m.
Yeah.
Yeah.
So, you can go and get yourself tested. Apart from that, most of the corporate sectors have liaised with, this is what I'm trying to tell, liaised with certain hospitals. So, they flush in their clientele to the private sector institutions. Then again, the general public can get into the government sector institutions. They can tell their complaint, fine, I have flu, fever, kind of anything. So, in the event if the examining doctor thinks or suspects over matters, he'll be tested. So, this mechanism is there. So, you cannot say the mechanism is not there. Mechanism is there.
No, but 1.5
we have
weeks
extended
ago,
it.
Yeah, 1.5 weeks ago, Dr. Hamdani, there were no antigen kits in Sri Lanka. I couldn't find one. I was supposed
You should
to
have
go
actually
overseas.
told me, Shamir.
Yeah,
I would have guided
could
you
have.
actually to places where we could.
But not everyone could talk to Dr. Hamdani.
Of course, I've been.
Get some
I've
interest,
been
can we?
speaking to most of these people.
Yeah. But never mind. Thank you very much, Dr. Hamdani, for your thoughts in the first round. I now move my attention to Professor Indika Karunathilaka, former president of the Sri Lanka Medical Association, as well as Secretary General of the Asia Pacific Academic Consortium for Public Health. Professor, if I may recollect right, you were the SLMA president when the COVID-19 was first spoken of. This was in the year 2019. And initially, you were very critical of the way in which the government handled the COVID-19 situation, talking about these panniers and all that. And that was not the way to go. You spoke about on our show, which show on Face the Nation, and said the government has to have a proper approach, a scientific approach to address these issues. And we were able to enlighten the public with regard to what the SLMA position was on the COVID-19 pandemic was at the end of the day. But right now, Professor Indika, are you satisfied the way in which the government is handling the situation with regard to COVID-19?
Yeah, thank you, Shamir. Thank you for putting a rather difficult kind of comment. Let me start by making a correction. Actually, it is not being critical about the government handling the situation. From the very beginning, we have been working in very close collaboration with the Ministry of Health, Dr. Hamdani and many. That was actually our policy, the Sri Lanka Medical Association, working in very close collaboration with the Ministry of Health. That has been our policy. And providing them the support and whenever necessary the guidance, that has been the way that we have been working. And again, definitely yes, from the very beginning, our stance was it has to be based on the science. And even now it remains so. Having said that, there is something that we need to remember, that the need to be pragmatic, because as Dr. Rajiv very correctly mentioned and very elaborately mentioned, that this virus is ever changing. The behavior is ever changing. It never allows us to settle into one particular pattern actually. If you take COVID-19, it is It is like a problem of unknowns really. Even now, it's a problem of unknowns. Now, for example, we think Omicron is milder variant, but still we really don't know. We really don't know even after a few days. If you are vaccinated, we see many patients who are not vaccinated are getting maybe severe form of illness. So still it's a problem of unknown. So therefore, the strategies actually change. Sometimes one strategy that you take in one point may be completely different from the strategy that you have taken later. One example is, say, isolation and quarantine nowadays. It's very much relaxed now. For example, if you have taken the booster dose and 3 doses, if you are first level contact, you don't need to get quarantined. But in the past, say in 2020, if you are a first level or second level contact, you will be definitely mandatory quarantine. That's why the need to be pragmatic. From time to time, the situations change and virus change, our target changes, so the decisions will have to change. Sometimes, as I mentioned, it may be something completely different to what we have practiced previously. It happens actually, it happens. I don't see a problem in there as long as it is based on science, as long as based on scientific principles and basic principles. However, having said that, misinformation and pseudosciences is something definitely. For example, there are certain remedies that have been promoted every time. And sometimes when people are so desperate, they go for these remedies. But actually, what we experience is for most people, even now, the SLMA 247 that we are conducting, the patient helpline, which has helped about 70,000 patients since August, what we have noticed is, for many, if you follow the basic measures like staying at home, taking a good rest, good nutrition, and good hydration, and maybe symptomatic management, you'll be fine. That is the case for over 80%. But many take advantage of the situation. That is what we call pseudoscience. For example, if you say, if you take a lot of fluids, you will feel better. But at the same time, if someone says, if you take this preparation or whatever, you will get cured, that is pseudoscience. So we have to based on science.
Right. So,
but the principles are the same.
Professor Karanthiraka, I just want to drag your attention to a statement that was made by the Minister of Health at one point, now the Minister of Media. Minister of Media at one point, now the Minister of Health, Minister Kelly Rambukwala, saying that if you do not get 2 doses, you won't be able to access any public state institutions or even any company. But there has never been a proper mechanism in play. Take me for an example, or take Shehan for an example, or take Hassan for an example. None of us are being checked whether we have got 2 doses when we enter a restaurant, when we enter a state institution, or even a bank for that matter. Anyone and everyone can walk in. So don't you think the government mechanism has to be more stringent to make sure, or not forcefully, but indirectly, to get people vaccinated? There has to be a proper mechanism in play, like in countries like Dubai.
Yeah, again, I suppose you have to follow multiple strategies because this is a new situation, fairly new situation, just over 2 years. So the mechanism that we are thinking about, they too are actually evolving. The mechanism that we want to develop, they are evolving. Not only evolving, sometimes we have to change the strategies as the virus changes. The goalpost or the target changes all the time. Therefore, I think going for one mechanism is not going to work. One single mechanism is not going to work. You have to go for multiple mechanisms. So, like making the vaccines available, then maybe social media, like we have mentioned, and giving them the correct information, and tackling means all these are important. So, having said that, I think this kind of carrot and stick approach is also important because certainly we are not going to have a perfect mechanism because it's always something that is evolving and changing.
Professor Karanthiraka, a very quick question before I open the floor for questions from our journalists. So 6.4 million people have taken the 3rd dose already. That means individuals who love themselves. Don't you think the government should roll out a 4th booster shot, at least for the 6.4 million people who are very concerned about their health?
Okay, a good question. But again, I think priorities should be priorities. So what the data, what the research worldwide shows us, or what the experience in Sri Lanka shows us is, those who have taken the third dose or the booster, they are the ones who basically face this situation. Even if they get the infection, they basically get a very mild infection, and they don't get, many of them don't get complications. So currently, I mean, all of us have noted that the third dose coverage is still not adequate, just over 40%. So I think our first target should be getting there first, because it is not a matter of
but
one
if the
person
government
being
is not
safe.
going to force this on people, if the government is not going to force this on people, how can you expect the numbers to rise to the 46% mark, which have not got vaccinated yet?
You have to go for multiple strategies. It's not, I mean, that's why the both
Like
approaches,
what? Like what?
Yeah, like the social media marketing and giving the correct information and even legislation. I think we have to go for, some time ago we were not thinking about legislations like the compulsory, like vaccination. But now even those approaches, it has to be a multiple approach to make sure that we are getting into that adequate level.
If someone needs to get the fourth booster shot, which target audience should the government focus on? I'm taking again Dubai as an example, because I was in the country just a couple of days ago, and those who have got the Sinopharm vaccine 2 doses are being encouraged to take the fourth booster shot as well. So in Sri Lanka also, the rollout mainly was Sinopharm. If that case be the scenario, Professor Karunatilaka, don't you think the fourth booster shot at least should be administered to those who have got the Sinopharm vaccine, at least as a preliminary step forward?
Okay, yeah. I think, again, the priority should be to make sure that the booster, at least the first booster, to be given those who have taken Sinopharm. That should be the step one. But having said that, yes, if there is a step, I don't think that official decision has been taken. In that case, for who are at risk, like the elderly who have taken Sinopharm 2 doses, they may be the target population probably. I think Dr. Rajiv is in a better position to explain that.
Right.
Yes.
Right. Thank you very much, the three gentlemen, for your insights in the first round. I open the floor for questions from our journalists. On to my immediate right is Hassan Shazuli, and on to my immediate left is Shehan Ranatunga, who's putting up a good show every night to make sure that we have some good guests on Face the Nation every night. Thank you very much, Shehan, for that. Azra has wiped her hands off completely and washed her hands off completely and given the responsibility to Shehan right now. So today our focus is, with regard to our topic, battling COVID-19, is to ensure that you know the importance at home with regard to getting the booster shot, as well as ensuring what sort of precautionary measures you have to undergo in the event you get a flu, you get a cough, you get a cold, or any symptoms related to COVID-19. So with that intention in mind, I open the floor for questions. Let's start off with Shehan.
Thank you, Shamir. My first question is to Dr. Hamdani. Doctor, let's look at the ideal scenario, and I'm about to ask you a political question, if I may, but I think you're the most qualified person to answer this question, as you are with the Health Ministry. It's a simple question, and it's very much in line with what's going on in the country right now. Let's consider ideal scenario. The whole country, all those who need to get themselves vaccinated, I'm talking about the booster, steps out and gets their jabs during the course of this week. We're talking about around 14 million people. First of all, are there enough booster jabs available, Doctor?
Of course, yes.
Right.
Answer is very bold and prudent. Of course, yes.
Now, my second question is, it's kind of taking off what Shamir said earlier. Doctor, when we were kids, our parents always encouraged us to eat your vegetables, take your greens. You know, they educate you, telling you the benefits of taking these things. Now, it's no secret that the public are aware that taking the booster is good for them, and yet it doesn't seem to be motivating them to go out there and get their booster jabs. So now we know that previously people stepped out and got the first dose, the second dose, a large majority did, and I feel that it was fear that motivated people to step out and get their vaccines, but it doesn't seem to be working anymore. So once again, do you think that perhaps the Health Ministry needs to do something more proactive to motivate people to step out and get their booster jabs. If I might just add one example, South Africa, I think it was today or yesterday, have tweaked their vaccination program slightly, where they've encouraged people to get their vaccinations as early as 3 months after a certain dose, as opposed to previous it was 6 months. So it seems to have had an effect on the public and their response. What do you have to say about this, Doctor?
Of course, yes. I think as Prof. Indika said, we need to use multiple strategies. Like, okay, fine. Now take it like why people are not coming. There might be so many reasons. As what you mentioned, I mean, we've also changed that strategy of, like, initially we've had the strategy of after contracting COVID 6 months. We've changed that strategy into 3 months. So we've also changed strategies because this is an evolving thing. There is no concrete confirmed measures you make, like build up a wall and keep like that. It doesn't work like that. So we need to go into people's mind. We need to inculcate, into people's mind that what is this and why it is important. As what you very well said, in the third phase, actually what happened, like we've experienced about 250 deaths per day, but 6,000 cases per day. People weren't going out. People were shivering of fear. So they were kind of motivated. That was kind of a motivate. That was kind of a deterrent factor, which pushed people in for vaccination. And there was a time where that we didn't have enough vaccines initially. So that was the other reason. So everybody was like rushing in, and people who cross borders too. Even your channel showed so much of time, like people cross borders to go into different areas to get themselves vaccinated. That is to protect themselves. Now they think, okay, fine, that this protection is enough. As Dr. Rajiv very well said, we never know how much of this is going to be evolving in future. This is going to go on like this because this is a global pandemic. This is not confined to our nation only. If it is confined to our nation only, fine, we know as of this rate, this will end up here. But this is a global pandemic. So this is dispersed everywhere. So within this context of the matter, like people should understand this. They should know. They should be knowing the fact which is the truth, because these are all scientifically based evidence. When WHO declares, when the scientific colleges declares, I mean, we have a scientific committee here, expert committee. So we all sit on that. So we declare on the basis of what is best to the people.
Yeah, but Dr. Hamdani, the point is, if there is a mechanism that has been rolled out by the government to ensure that individuals who are not vaccinated with the 3 doses cannot enter public places, or they have to produce their vaccination card if they have to enter public places. It could be through an app, because today's technology has elevated us to a different pedestal altogether. Won't that be the most prudent decision? Because this has been tested and tried in countries like Australia. It has been tested and tried in countries like Dubai. It has been tested and tried in countries like India. It has been tested and tried in many South Asian countries. So isn't this the best opportunity that we have? People cannot go. I've just got a message from one of our viewers who are watching the show, who says that I contracted COVID from a father and son who came to work in my garden a couple of weeks back. I realized later that both of them had not got their vaccination. And as a result of that, these individuals have given me the virus. The father and son go from home to home, place to place, cleaning gardens, and the daughter works in a gym. Isn't this a health hazard? So you can address these problems.
Of course.
These are little problems. You don't have to think, have different strategies or different alignments or different health goals. The only issue is just have a proper working app, and through the app monitor every individual who has got the booster shot. If they have not got it, don't let them enter and be a health hazard. Simple as that.
Of course, yes. I think that is why the Gazette notification was issued based on 30th of April.
Right.
From 30th of April, it is going to be enacted.
Yeah.
And in the meantime, because...
But Dr. Hamdani, several months ago, I'm sorry to put you on the spot here, but several months ago, Dr. Hamdani, the minister in charge said if you don't get the 2 vaccinations, you can't even enter public place, and it was also gazetted. But where is it in practice?
So no, it's actually like now we consider as complete vaccination along with the booster jab as well. People who have got 3 doses are considered as completely vaccinated. So that is how this Gazette notification came, and which will be enacted in 30th of April, from 30th of April rather. Within the meantime, we're developing an app along with the Ministry of Technology. We're developing an app.
So there is a process that...
Yeah, there is a process, because this cannot be done overnight. Unlike what you say in Dubai, Shamir.
Yeah.
That's
there is no question about that. I think
we are in the process
we
of
are
it.
Still a developing nation.
Exactly.
We have time. It takes time, and we totally understand. But
so it's in the process.
There a process in
yeah,
place?
It's in the
That's
process. It's in the process. We've discussed with the Ministry of Technology also. They are in line with us.
Right.
So it's going to be an app, as what you told. Yeah. It's going to be an app. So it's going to come into action.
Yeah, Dr. Rajiv, you want to add something to that?
No.
Can I, Shami, can I
yes,
add to what? Yeah, actually even now there's a smart vaccination card available for those who go abroad. Basically, you can go to the website, the Ministry of Health website, and apply, and you can get the smart vaccination card, which you can carry on your phone and with the QR code. Yeah. So the possibility are there. So hopefully the systems...
But I don't know, Professor Indika, whether you have tested and tried that vaccination card, because I got the 2 doses, went overseas, came back, got the 3rd jab, tried to get the vaccination card. I couldn't get it for 3 months. So the process is not accurately put in place. And if you scan the QR code which is there, it goes to an alternative site which says data not available. So there are problems. Thank God in other countries they don't look at the vaccination card issued by the Sri Lankan health authorities. They only depend on...
let me interrupt you here.
Yeah, of course. This is my bit experience.
This is actually not to counteract you on the basis.
Yeah, no, this is my bit experience.
Exactly.
It's only right as journalists if I tell you my experience also.
Of course, yes. Because that's going to be the public concern.
Absolutely.
So thank you very much for raising this concern.
Yeah.
We've also come into... kind of, few people have, notified me on the same basis which you are telling.
Yeah.
So there are 2-3 things which matters on that, but I'm not trying to find fault on individuals who have entered that a change of number, batch number changes, the place changes, right?
Yeah.
So these are minor problems, but we are actually rectifying all of them. Most of them had been rectified.
Yeah.
Now Shamir, if you actually log into the system and you apply for it, I think obviously you'll get it within 24 hours.
Thank you very much for that. So getting back to Dr. Rajiv with regard to the drive that we have. Dr. Rajiv, tell us a little bit about the vaccination, the different types of vaccination that are available right now. Pfizer is being administered across the board very rapidly and vividly, as you can see, everywhere in the world now. Do you think there is a mafia behind these vaccination companies who are trying to promote their vaccinations across the world?
No, I don't think there is a mafia. If you look at the vaccines, right, they were in short supply some time ago. So basically, I think it is something like survival of the fittest now. So there was a whole range of vaccines that were available, and today we find that the vaccines like the mRNA vaccines.
When you say mRNA vaccines, what are the vaccines?
That is like Pfizer and Moderna.
Right. Okay.
And certain of the what are called vector vaccines like AstraZeneca, and Sputnik went off, but that was quite a good vaccine. They are more efficient in producing a immunity against the virus compared to, let's say, the inactivated vaccines.
Why aren't we talking about the Sputnik virus anymore? What's the reason?
Because I think they had a problem in producing the second, it was 2 doses. You had the adeno 5 and the adeno 26.
Right.
So you give the adeno 26 first and the adeno 5 second. I think they had a problem in producing the second germ.
Right.
So that's why it went off.
So, Dr. Rajiv, you spoke about the T cells. We speak about T cells which are immunity boosters for individuals. Can an individual go to a private hospital and get their immunity tested and ensure that they are being properly vaccinated and their immunity is good enough to fight the COVID-19 virus?
Yeah. Now, what is available in the private sector and in most countries, except in the research setting, is
Right.
looking at antibodies.
Right.
Right? So now the antibodies that most commercial companies have are the antibodies against the original virus, the Wuhan strain. And there are antibodies maybe against the Delta variant. Now, it's a bit technical. Is it okay my telling technical things?
No problem, Dr.
Yeah, so
Rajiv.
when you talk about antibodies,
Right.
there are some good antibodies, that is what are called the neutralizing antibodies. So what the antibody does, or what you want the antibody to do, is to prevent the virus from getting into the cell, because the virus needs the cell to multiply. If it doesn't get inside the cell, it doesn't cause problems, except of course being shed. So an antibody does, what the antibody does is prevent this, and these are called neutralizing antibodies. So to look at protection, you have to have a test kit that recognizes neutralizing antibodies. Now, unfortunately, most of the kits that are available don't look at neutralizing antibodies. They look at all the antibodies. Some of those antibodies are not relevant when it comes to protection. That is the problem. So just because you have antibodies does not mean that you are protected.
Right.
To be actually protected, if you can show this is an Omicron, you have neutralizing antibodies against Omicron, then you know, okay, you may be protected. Of course, we don't know the actual level of protection, what is called correlates. But such a kit is not available.
Dr. Rajiv, now in our opening remarks, we were talking about examples like Israel, which is promoting the booster vaccine among its citizens. There is a popular conception or misconception. I would like you to clarify that as well. Because in Sri Lanka, we had the Sinopharm vaccine, which was given as the first 2 doses, and then the government began administering Pfizer as the 3rd dose. Whereas in Israel, we had 3 doses of Pfizer given throughout. Now, here in this country, there is a concern that we took 2 doses of Sinopharm, which has a much lesser efficacy compared to Pfizer. So what is the point of obtaining the booster jab? That seems to be the thought process behind those, some of the people who don't want to obtain the booster vaccine. What do you have to say regarding that? Can you clarify that first?
Yeah, now if you look at these vaccines, you take something like the measles virus, which is just one particular virus, right? It doesn't change. 1 dose or maybe 2 doses will probably give you almost lifetime protection. When it comes to the COVID, the SARS-CoV virus, no vaccine gives long-term protection. So after some time, the protection wanes. So the waning of protection is more with the inactivated vaccines, that is Sinopharm and Sinovac, compared to the Pfizer and the AstraZeneca. So whatever the vaccine, Sinopharm or AstraZeneca or Pfizer, you will need a boost. That is absolutely necessary.
Do you feel a second booster is necessary, doctor?
It's like this. There are people who cannot produce antibodies or even T cells. So particularly people with cancers, who are on immunosuppressives, who have genetic immune deficiencies and so on. I would think, now we are doing a study with Professor Malavi gave, where we are looking at patients with genetic immune deficiencies. And we are looking at the T cell responses and the B cell responses and the memory. And we find that 2 doses, they have not produced a good antibody response. So now we are looking after the 3rd dose to see whether they have a response. I'm sure they will not have. Such people will definitely need a fourth dose.
But Dr. Rajiv, now I was reading quite a bit on how booster vaccines work, and I came across this study by the European Medical Agency, which is a recognized health body. In one of their research, they point out that the fourth booster shot may not be effective because we are burdening our immune system with immunization. That is their argument, and they say that it may not prove to be effective as it seems to be. Can you shed some light on that?
Yeah, now first of all, I think we need to get our terms correct. There is no third booster or fourth booster. That is the first booster and the second booster. So you have what is called a primary vaccination. So that is for generally immunocompetent people, 2 doses. That's a priming dose. And then you have the first booster and the second booster. Now, people who have not produced a good immune response with 2 doses, they should be given a third dose. And that is not called a booster, that is the primary schedule. So for example, in the UK, people with certain diseases, they are given 3 doses. And then a 4th dose, which is actually the booster, is recommended 3 months after the 3rd dose. That is the first booster, right? So that is people who do not have a very good immune system. Now in Israel, they have given the 4th dose to people over 60. Now there are 2 studies. One is a clinical trial in Israel where they have given people over 18 years. 4th dose, that is the second booster. And they have found that the efficacy of the 4th dose compared to the 3rd dose is 30% more. In other words, there's a 30% improvement in vaccine efficacy. So the 4th dose has worked against clinical disease, 40% against severe disease. Whereas when you look at the population study, people over 60 who are given the 4th dose, there is a study which shows, that is not a clinical trial, they have looked at the infection rate. There's the improvement or the protection against clinical disease is twice that of people who have got only 3 doses. And protection against severe disease is 4 times that of people who have got 3 doses. So that is, in Israel, there is at least a short-term protection with the 4th dose.
So how long
that is
apart?
in the over 60s. But unfortunately, this is only for the first month. They have not studied it further. I mean, my gut feeling is that with time, that protection will also go down. So that's what I said at the beginning. This virus, you are not going to get sustained protection against clinical disease. You will not. With time, with a 3rd dose or a 4th dose or a 5th dose, if you wait for some time, you will get infected and
so
you will
does
get
it mean,
clinical disease.
Doctor, that in your opening remarks you said that the way forward is to formulate a new vaccine as the solution. So does it mean that people will have to keep getting boosters until that time arrives?
No, I don't think that is that you have to continue giving boosters. For example, they are now trying to, I think Pfizer, Pfizer, they are going to test a Omicron vaccine. So we will not have to wait years to get an Omicron vaccine. The problem is if the Omicron changes to, I don't know, Omega or whatever, a new variant. But as I said at the beginning, we will have to live with this virus. It will continue for some time, maybe almost indefinitely. What will happen is the vaccines that have been given, as well as the natural infections that we will definitely get Omicron. We will definitely get certain further variants, but people who have been vaccinated and boosted will not get severe disease. And when you get more and more infections, there will come a time when we are protected long term against severe disease, but we might get a breakthrough infection, a cold or whatever.
So in countries like
a flu, normal cold.
Dr. Rajiv, in countries like the UK, it's not mandatory to wear the face mask. But in countries like in the subcontinent, you see that it has been made mandatory to wear face masks. How effective are this face mask mechanism in battling COVID-19?
Definitely, face masks are essential. Now you can see all three of us are wearing face masks. That means that we are concerned about spreading the virus and also concerned about getting infected. I hope you are not representative of the normal population.
Right.
Because you all are not wearing masks.
Yeah. No,
Certainly,
yeah.
all of us should wear masks, particularly when you are with people that you don't live with, right? Say, of course, in the house, in your own house, you should not be you don't have to wear masks. But otherwise, I think all of us should wear masks. And the important thing is this, I think what is forgotten is that even if you give a booster, it doesn't mean that you do not transmit the virus. Remember that. You may have 3 boosters, or you may have 3 doses, you may have the 4th dose, but still you can transmit the virus.
Yeah. So, Professor,
So you have to wear the mask.
yeah. So, Professor Indika, talking about the masks and the need of the hour is to make sure that we follow the health guidelines given by the Public Health Bureau, Promotion Bureau of Sri Lanka. That is to wash your hands, maintain social distancing, and also to wear face masks. We see a lot of activity right now. In Colombo, if you go to, I was passing by the Vihara Mahadevi Park yesterday, and I saw so many people forgetting social distancing, but wearing face masks, of course, playing at the Vihara Mahadevi Park, and there was no one to police them, to say that they have to maintain social distancing or they have to maintain the mask that they have removed. And none of that is being taken center stage right now as we speak. So if that case be the scenario, can we ever see an end to this, even in Sri Lanka for that matter?
Yeah, again, we are getting into very important part of this discussion, and previously also this concern that are we going to be with COVID forever? Are we going to get booster dose after booster, vaccine after vaccine? Is this the way forward? Probably, I think the solution lies in gaining the control, because as Dr. Rajiv very correctly mentioned, that we are going to live with COVID for some time. We don't know how long, but it's a matter of gaining control, and it's a matter of doing what we can do. So I think that could be the way forward, because there is no way that we can stop this virus mutating and having more variants, and probably sometimes more virulent variant at that we cannot control. But there are things that we can, or within our hands. So it's for me, living with COVID or new normal means doing what we can within our control. So what are those things? What we can do to prevent the spread? What we can do to prevent the spread or getting the infection? And what we can do to prevent complications if we get the disease? I think if we can stick to those basics, so to prevent or to reduce the severe disease, what we can do is, obviously, all the data has shown that you have to get the booster. There's no doubt about that. And this could be, in a way, this could be a window of opportunity for all of us, because at the moment, we are having some control. Unlike in August, at the moment, the health system is not over.
But the number of deaths right now, Professor Indika, has gone up between 25 to 30 right now for a day.
I fully agree with.
So the numbers are increasing as we speak.
That's why I said this is the window of opportunity for us to gain control. I'm not saying that we have gained control to gain control. This is a window of opportunity. And to do that, what should we do? First thing is getting the vaccine. Actually, this should have happened long ago, but better late than never. So step 1 is getting the vaccine. Step 2 is to prevent or reduce the spread as much as possible. At the moment, the way things are happening, it is spreading very fast. But still, if you adhere to the basics, because that is what we can do, adhering to the social distancing as much as possible, and then wearing mask and other measures as much as possible. That is what we can do. Thirdly, what we can do is in case, in the eventuality that we get the disease, what can we do? What
So
can,
I just want,
can we,
yeah. Professor, just interrupt me
can
for a
I
second.
finish, Shamir? What can we, if in case that we get the disease, what can we do?
Right.
Because that also would reduce the number of deaths and the complications. For example, in case we get the symptoms, nowadays, when you get the symptoms, there is the perception that it's a viral flu. Again, that's a totally wrong conception, and the misconception can be very dangerous. So, if we get these symptoms, one thing is, if possible, get tested, get medical advice, because actually
If not, quarantine yourself.
Not diagnose yourself. And actually, the good news is we can control this.
Right.
Good news is even if we get the disease,
Right.
most of us, if we are empowered, for example, what most of us need to do is get medical advice, get tested, and if you don't have severe symptoms, stay at home, get a very good rest. Get a very good rest, good hydration, good nutrition, 80% would be fine. And at the same time, monitor for any red flags. For example, difficulty in breathing, so on and so forth. If so, get admitted as soon as possible. Then the doctors and the health system will do what is required. And also at the same time, avoid going for unnecessary medication, which will do more harm. Because good news is actually for most of you, you really don't need medicines other than maybe simple paracetamol or maybe sometimes antihistamine. You don't need medicines. Sometimes if you take medicines, what happens is it can do more damage. For example, antibiotics. It won't do any good for a viral disease. Or some other drugs like say ivermectin or many others which are used rampantly. They are actually misused. So we have to actually empower the people. If we empower the people to do what to do, to prevent it, prevent the spread and prevent complications, and what to do if you have the disease. I think if we can empower, we can gain control.
So, Professor Indika, a few months ago, when the Delta variant was very prominent in Sri Lanka, there were many mechanisms that were launched by the governments where people could call a health line, inform about the symptoms that they have. Is that health line still available for the public to do so, or?
Yeah, there were several helplines.
Okay.
Initially, it was this was during the August time period where
That's right.
the surge was there.
August, September, August.
So it was actually initially as an integrated system where one system was through the National Operations Center for COVID-19, that was a SMS system, and other one was from with the Sri Lanka Medical Association, which we have initiated with the Ministry of Health and with Suasaria and Mobitel. Again, those helplines are functioning. And recently, the National Operations Center has ceased operations. However, the 247 system is still functioning, and we still get a lot of calls. And actually, that has really helped us like a sentinel to find out what is happening.
So people who have symptoms could still call the number available and get some redress from a specialist doctor who is available 24/7 around the clock.
24/7, yeah.
So, Dr. Hamdani, just to pose a question to you with regard to the number of ICU beds. There is right now, with the Omicron variant playing a major role as far as COVID is concerned, the government was able to allocate approximately around 70 ICU beds for those infected with COVID-19 to get some redress. Out of that 70 beds right now, how many beds are occupied by COVID-19 patients at present who are finding it difficult to breathe or probably under severe disease at the moment?
Let me correct you first. As of now, as of this hour, we are actually currently functioning about 84 ICU
84 beds. Okay.
Out of
because
that,
in September last year, the number stood at 70. Yeah.
Yes, 73 are filled.
Right. Okay. But now, how many beds are occupied at the moment?
73 are filled by now.
73 are filled.
Now, there was a time where we faced the third phase of the COVID.
Right.
We actually got that ICU capacity into 202.
At the peak of the
peak
of the situation,
the third phase, it was 202. Then gradually we reduced because we were starting our normal other functions in the hospitals, general hospitals also. So we had to curtail certain beds and give them to the normal people who come with normal diseases or post-operative people. So as of now, we are functioning 84. Out of that, 63 are filled.
Yeah, Dr. Hamdani, I also need to draw your attention to the regulations that the Health Ministry revises on a constant basis. We know that the Omicron variant was first detected in Africa in early December. That was somewhere around the
November 16th.
Sorry?
16th of November.
16th of November, okay.
South Africa.
So we had plenty of time to stop that variant from entering the country. However, the Health Ministry updated its guidelines on tourists arriving in the country or foreigners arriving in the country only on the 27th of January this year. Why was there a huge delay? And I also need to just point this out. Although we revised our restrictions or the regulations on travelers on the 27th of January, we see that COVID-19 cases have been crossing the 1,000 mark from the 1st of February. Does it mean that, doesn't it sort of imply that these regulations have failed and we could have prevented this variant from entering the country?
It's like this. So this is a global pandemic situation. We are not an alienated country that living outside this globe. Even if you put any amount of protection, still it will come in.
But do you think
So
that...
we had taken enough of measures to contain and control it. So you see there have been cases, 18 million cases been reported on a single day around the globe. Within proportions take, we are actually maintaining around 1,200, 1,300. So that is the leverage. That is the leverage actually we are placing of our second vaccination, which most of the people do not understand. Most of the people take it on the other side of the coin. But what I'm trying to tell you here is why this plateau is been maintained at that level, and why this death rate where Shamir was telling is 20 to 30, somewhere around fluctuating at that level, is because of the leverage we have achieved through our second dose vaccination. Totally about 12 population, we've roughly vaccinated about 14 million, which is almost about 82%.
Dr. Hamdani, let's leave
But the first booster shot, Dr. Hamdani, is only 46%, right?
Yeah, it's 46%, 6.4 million.
Right, let's leave the vaccination aside since we have spoken
No, but
about
very quickly, Hassan, just following up with one of the questions that you earlier asked, Dr. Hamdani, we got it initially all wrong, right? We were going behind tonics, we were going behind putting pots to riverbeds, you know. We got it wrong during the initial stage, don't you think so? Now, you were very active in this whole process for a very long time. From the first patient who was detected on the 27th of January, if I'm not mistaken.
Yes.
You were very active, but initially we got it all wrong, right, Dr. Hamdani?
Now, it's like this.
Because no other country, we made the headlines. We made the headlines on Al Jazeera for promoting a tonic in the country by the parliamentarians in this resplendent island nation initially. But that is the past. No point of talking about spilled milk, because as I always say, when the horse is bolted to the stables, no point of talking about such matters. But we got it all wrong right at the start.
Shamir, it's like this. Like, this is an unprecedented disease which nobody knew anything about it. Like, so as Dr. Rajiv very well said,
but science,
this is evolving. So scientific based evidence was evolving by then.
But does it justify?
Tonics were not scientifically.
Exactly. We were not
we
into
had the
that.
health
We were not
also,
into that.
we had the health minister Pavitra Vanyarach also consuming this tonic right at the start. Parliamentarians were consuming, the speaker was consuming, and majority of them were infected with COVID-19. So initially, Dr. Hamdani, we got it all wrong, right?
No, from the initial, for the inception of the disease or the first case, identification of the first case of the disease, what we stood was like on scientific basis. I think we had a scientific
this was definitely Dr. Hamdani
deciding on how to manage.
Yeah, but not tonics. No, see, Dr. Hamdani,
it was never recommended on the scientific committee.
No, absolutely. Now, individuals like the head of the Association of Medical Specialists came on the show initially and said we have to have a home quarantine system in Sri Lanka. If we don't have a home quarantine system, we will be overwhelmed with the numbers. The government didn't give any heed at that time. However, because of the pressure exerted by organizations like the SLMA as well as the AMS at that time to the government had to heed to the orders of the professional bodies at that time. Because no point of talking about the Government Medical Officers Association at the end of the day. But there were associations which were very, very powerful at that time who made a lot of concern with regard to the situation in Sri Lanka. And I think credit has to go to organizations like the SLMA as well as the AMS at that time for making the government realize where they made things wrong, and even the media for that matter.
Of course, Shamir, I always give due respect to everybody who has given us suggestions.
Yeah.
So this discussion, I'll have to be very open and very transparent about it.
Yeah.
This discussion of this home-based care was actually discussed before all these people, before 1 year, with me, Professor Indika Karnawatthilaka, Dr. Ananda Vijay Vikrama, and Professor Atula Sumathipala, and then Director General of Health Services, Dr. Anil Jasinghe.
But Anil Jasinghe was also promoted.
That was long back. So we had this plan because we knew what was our actual capacity all about, and where we could go, because these people know how the caseloads were flushing in daily.
No, see, that's what Dr. Hamda now. Individuals like you are very professional in this. You have not only been, you have been attached to the Health Ministry for a very long period of time. Looking at your profile, it's very clear that you are a man with a lot of integrity. But when individuals like, as you mentioned, Dr. Anil Jasinghe said, to go with a home-based solution, he was just transferred to the Ministry of Environment as a secretary. So there was a no, it's not your problem, but I'm saying there was a loophole in this entire process right at the start. However, right now I'm very glad that they have got the act together. But how do we promote the booster shot to the general public? What is the mechanism that we should adopt now? Because let's forget about what happened in the past. Let's forget about all those matters, issues, whatever the government did wrong or whatever it is, or the opposition or whatever it is. Let's put that aside. What must we do now?
Okay, Samir, let me not take it like this. Like, if at all to be taken up like this, like if A does something, B sees differently, B does something, A sees differently, we wouldn't have reached here. We wouldn't have been here. It was a combined effort by everybody. Especially, I think I should be thanking the military, the Tri-Forces and the police, because this was a concept of the civilian-military synergy comes into play.
So, despite whatever people said about militarization, they did a good job.
So, see, this is where the terminology is wrong. It's not militarization, it's civilian-military synergy, which a lot of other nations have practiced.
No, they did a very good job.
There had been nations practicing this.
I got my boost shot from an Air Force personnel at the eye hospital when I was supposed to go overseas. So it was a very good plan.
That is how even media. I should thank the media also, because like the most of the information reached people through y'all. Let that be printed or digital, through y'all, because however the scientific evidence or collection of information we have, if it is not disseminated to people, they do not know. So this is one of the main concerns of this booster hesitancy. This is one of the main concerns of this booster hesitancy. As Dr. Rajiv very well said, there had been a lot of disinformation and misinformation. Now, see, it's like this. You getting the jab today, okay, you get fever next day. You call your friend, you call your neighbor, you call anybody of your colleagues and tell, I got fever, no? Very painful, no? Fine. After 2 days, will you call him and tell, the fever went off next day, I'm back to work? You would not tell that. It's like the goal. It's like the goal. People will only remember the goal hit, because there only you score points.
But actually, Dr. Hamdani,
yes.
I think the real concern with the booster or these vaccines is actually not even about the side effects, like the short-term side effects, like the fever you mentioned. There's a genuine fear among people that if you take these boosters, vaccines, you
become
injecting
impotent.
yourself over a prolonged, repeatedly, over a number of times. They're afraid that this will have long-term effects in the future.
scientifically not proven anywhere. So,
Well,
but that is what Shamir was telling.
Can I
Yes,
answer
please,
that question?
please, Dr. Nisir.
Now take the triple vaccine or now the pentavalent or the hexavalent. Say the tetanus. You give it at 2 months, you give it at 4 months, you give it at 6 months, you give it at 18 months, you give it at 5 years, you give it at 12 years. So that's 6. Has tetanus, has it caused problems?
I think
It
this
doesn't.
is a message that needs to be given out more. People need to be assured that this is a tried, tested mechanism and not just something that
Yes.
Yeah.
emerged for COVID-19.
As Shahan correctly articulated, Dr. Rajiv, we are having this show today to promote the people to go and get their booster shot because it's available freely by the government. It has been rolled out extremely very well by the Health Ministry as well as the Triforces, as Dr. Hamdani mentioned before. And you have to go and get the 3rd shot, which is the first boost shot that you are supposed to get. Dr. Rajiv, I just want to pose a question to you. What about those individuals who have got the Johnson & Johnson? That is a 1-dose vaccination when it came out. So even those individuals have to be
Yes.
taking the
Yes.
booster
Yes.
or the second shot for them?
Yes,
They have to as well.
they have to.
Okay. I know, Dr. Rajiv, it's a very contention topic when we speak about vaccinations in Sri Lanka today because of the many issues that we're facing in terms of geopolitical instability and all that and more. But if you look at it, Doctor, what is your message for individuals who have got the vaccinations? Like you have 14.082 million who have got the second dose. The first dose has been quite very well rolled out because the number stands at 16.849 million. However, the third dose has only been rolled out to 6.489 million. Why must the people go and take the booster shot at least now, this very moment?
The reason is, there are many reasons. One is Omicron is spreading, right? We know that it's spreading.
No, but BA2 is lethal. That's what people are saying.
No, I'm not saying BA2 is
Right.
lethal. There is one study which shows that BA2 can be dangerous.
Can be dangerous,
Yeah,
right?
it is not peer reviewed. It is just one study. So we don't know, but it is possible, right? So there is a potential of BA2 taking over from BA1 and causing havoc. So in such instances, if people with 2 doses probably may not have enough protection against BA2, we don't know.
Because an associate professor of the epidemiology unit at the Yale School of Public Health is saying that it could spread 30% more easily
Yeah,
than the Omicron BA1 variant.
yes. It is, for example, if it is like BA1, whether it's 30% or not, it's probably not a problem. But there is information or there is evidence that it may be more dangerous because it affects the lung, not the bronchi. So that is a dangerous thing. If it is true, and I'm repeating it, if it is true,
If it is true.
then it may be a problem because you have a variant which is as dangerous as Delta and which is more transmissible than Delta. So in such instances, people who have got just the 2 doses may not be protected enough.
So do we still have Delta playing a major role in Sri Lanka?
No,
Not anymore.
no, not anymore.
So is that good news?
Well, if it is BA1, which is less dangerous than Delta, then it is good news.
But still, for all, people have to get their booster shot.
Definitely. Because
irrespective of whether it's Delta or Omicron or whatever it is.
One is BA2,
Yeah.
potential for damage. It may be another variant. We don't know. So the problem is we are not fully protected with 2 doses.
So, Professor Karanthilaka, I happened to visit down south several weeks ago, and there was so many tourists in down south who have come on leisure to Sri Lanka, and that's also important because at the end of the day, the Sri Lankan economy has to boost. We are right now in dire straits in terms of finding US dollars, exchange rates, so on and so forth. So it's good news. But the flip side of it is most of these tourists who come to Sri Lanka are not wearing their masks. Why is that?
Yeah, I mean, again, there are situations that cannot be completely controlled. So again, it becomes a matter of basically adhering to the principles as much as possible. Now, previously there was a very interesting discussion that was going on. Let me get back to that a little bit first, because what you had with Dr.
Yes, of
Hamdani
course,
regarding the science, pseudoscience, and the government, so on and so forth. Let me start on that first, because then I can get into your question. It was very interesting. Now, one thing we have to remember is actually this science regarding COVID is something that is evolving. The practices are evolving. So, for example, when we had the first seminar regarding COVID-19 at the national level in January 2020, none of us knew much about this. Later, knowledge has been evolving. You could remember sometimes in the first initial phase, patients were kept in the hospital for months and months till the PCR gets negative. Now we know it's pointless. Now we know within 10 days or so, sometimes even less, the patient cease to be infectious. So there is no need to do PCR. They can be discharged, and majority can be basically managed at home. Now we know that if you rest very well during the initial phase, if you are fully vaccinated, good hydration, your outcome is very good. Those things are actually evolving. So the science in COVID has been evolving.
So then those days it was 14 days, now it has reduced to 7 days.
Not 14 days. At the very beginning, if you could remember,
very beginning it was around 21 days. You had to do exit PCR as well.
In the hospital for 3 months till the PCR becomes negative. But only now we know that PCR can remain positive even up to 3 months, but the patient is not infectious. It's not the patient actually. So that's why we don't do exit PCRs anymore in asymptomatic. So the knowledge is actually evolving. Every day the knowledge is evolving. That is where, when the knowledge is evolving, it may be rather slow to get into all the sections in the country or in the world. That is where, that is that vacuum, that is where the pseudosciences come into the vacuum. So that's why all these things about the tonics and different treatment remedies, they actually get into the vacuum. So that is where the responsibility. So again, whose responsibility is this? Now we were talking about the government. Who is government? Actually speaking, in the broader sense, government is all of us, not few individuals. That is why I actually strongly believe that all of us should be empowered. All of us should empower others also on what to do. Right. And how to prevent, what to do, so on and so forth.
So there were instances, Professor Karunatilaka, that in certain instances we say how contagious the virus is, where the wife has got tested positive, whereas the husband has tested negative. What is the reason behind this? There were many instances. I can give a classic example in our office. One of our colleagues' wife was tested positive, but the husband tested negative. How can that happen?
Very good question, Samir. One thing that we notice nowadays with our SLMA 247, which have basically catered for 70,000 patients, now we notice that the spread is happening very fast. Like the spread is happening within the household, and sometimes it can happen within several rounds. First round, maybe the children getting the disease, bringing the disease. Next round, others get in. And it goes on. It might happen within several rounds. It happens very fast. So what we actually notice is it's almost invariably everyone within the household gets infected. Something like that. Even if you are careful, still it can happen. But the good news is, if you are fully vaccinated and if you don't have comorbid conditions, and also if you have taken the necessary precautions like having a good rest as soon as you get the symptoms, your prognosis is very good. So, spreading fast. The answer to your question is possible. Actually, it's very possible because there's something called sensitivity in the testing. So, if you take antigen, the sensitivity is comparably low compared to PCR. But in a condition like that, in a condition like this, where the disease is spreading so fast, then even antigen would yield a positive result if you are actually positive. But having said that, there are certain instances, depending on maybe the technique that you are taking, or depending on the pace of the disease that the patient is in, it may be negative. That is very possible because it all depends on the viral load in the sample that you are taking.
Right. So, getting back to what Professor Karunathilake spoke about, doing a rapid antigen test, Dr. Hamdani. We spoke about this earlier as well, but I'm going to repose this question to you once again because I did not get a clear answer. Why aren't we letting private sector pharmacies to bring down rapid antigen test kits so it's freely available to any member of the public? If they want to test it, go out there. They don't have to go to Campbell Park between 9 a.m. and 2 p.m. But they can just go to the pharmacy, purchase it over a counter at 2,000 rupees and do the antigen at home by themselves because it's very, very simple. Why isn't it available? Is it because of the dollar crisis in Sri Lanka that the government doesn't want to allow individuals to bring down rapid antigen tests?
I am much obliged to answer always, Shamir.
Yeah.
Thank you very much for posing that question over again.
Yeah.
And letting me know that I have not answered it properly. I think I have taken that answer very correctly and very prudently, which I was telling you from the beginning.
Yeah.
So these antigen kits has to be, certified. It's not like simply that you go buy an antigen kit and come and test yourself, because it has to be certified through the NMRA, National Medicinal Regulatory Authority here in Sri Lanka, and has to be proven that it gives results. I mean, you can produce, you can have any amount of antigen kits. If you go into any of the world market, you can have antigen kits for about $2 also, right? Whereas the standard price goes as $5, but you can get it for $2, and you can bring it over some different mechanisms. But what is the assurance you have testing through that will give prudent results?
That is why
this is one of the reasons. Yeah. The secondly, people should know how to test themselves, right? False positivity, false negativity, both will be dangerous. You are giving false assurance to people. Can you assure that? Imagine you testing yourself, Shamir, right? And you just put it halfway through, get it done. Okay, I'm negative. Still you have fever. Still you have headache. Still you have backache. Still you have running nose. Still you come to work. Whom are you cheating?
Dr. Hamdani, I think
this is actually the responsibility comes into action is here. So few things we'll have to ground it before we allow them.
Yeah, because the Sri Lankan health regulatory framework through the NMRA is very stringent. You can't bring down medicine or medical equipment for the whim and fancy of any pharmacy or any private sector company. It has to go through a proper through a proper channel.
Yeah.
So when that channel is available in Sri Lanka, my question to you was, is it because of the dollar crisis we are not letting?
No.
Because there was a problem with medicine available at several hospitals also not having ample medicine because of the dollar shortage in Sri Lanka.
No, there are certain orders being
because when you're a journalist, you start thinking, is it why? Because
of course, yes, Shamir. That's the way you should be thinking. Also, I mean, you should be
one of the reasons for not having.
Exactly. Though this is predominantly a health problem.
Because
let me speak it out, Shamir, on a proper basis. So there are few reasons. This is one of the reasons because whatever said and done,
there is an NMRA already.
So NMRA approval has to be approval has to be granted. Number one. Secondly, the people has to be trained, or people should know how to do it properly.
Yeah. Right? That is why awareness is important.
And then it can be made widely available. So these are in the discussion. So how to evolve these things? Because now what you are telling is also very correct. On a basis, okay, fine. You'll have to go into some different places, wasting your time over there to get yourself tested.
No, on the way you might infect someone else.
Why might well as like you can have it at home and test yourself and say that you are negative or positive, and you can continue your day-to-day activities. True, it's in the process of discussion to come in future. Where we will look into that as well. So it is in the process of it. But within the meantime, so we are in the process of giving the public the maximum benefit, because we are a nation which is serving free
Professor Hamdani,
health.
if I may interrupt you for a second.
Of course.
I want to pick Dr. Rajiva's brain on this, because Dr. Rajiva is also part of the MRI of Sri Lanka as well, though despite the fact that you're not sitting here today in that capacity. Do you buy Dr. Hamdani's argument about people not being able to test by themselves in a situation of this sort? I want to pick your brains on this, because I strongly believe at least the fraternity in Colombo who goes out, they have the levels of literacy to test themselves, at least in the urban areas of Colombo. I am of that view, but I don't know the panelists' opinion on this. I just want to pick your brains on this.
Well, I have been, tested many times, 5-6 times.
Is it antigen or PCRs?
Antigen once, PCR a number of times.
Sure, sure.
And there were 1 or 2 occasions when I thought the person who was doing the testing was an archaeologist, because he was excavating my my nose and probably was going towards the brain.
Right, okay.
Now the question is, I don't know whether that is necessary, but if I was going to do that, probably I wouldn't go to that extent, because it's painful. So I don't know, doing antigen testing on yourself, whether it would be as effective or as sensitive as someone else with experience doing it. So it's quite possible. I'm not saying that I totally agree with Dr. Hamdani, but probably you will not get ideal results if you're doing it yourself.
Right. Okay.
So I'm not sure about that.
Yeah. So Dr. Hamdani, getting back into what Dr. Rajiva said with regard to the excavations that are taking place. So I want to give a classic example. I'm very scared of needles. I have a phobia for needles as well as these PCR tests or antigen kits. But when I did my PCR at the Dubai airport, I didn't even feel it. I was okay to do another PCR test. It was well done.
If it was not that expensive.
No, it was expensive at the.
That's what I'm telling you. You would have been probably doing another PCR if it was not expensive.
But no, getting back into the question. So, the Sri Lankans, are they well trained to do these PCR? Because people have a fear. I don't want to do a PCR because it may hurt me.
Of course, you can ask Dr. Rajiv also that. I mean, we have trained swabbers initially. These swabbers are experienced people. We have trained them from the initial phase.
But actually, Dr. Hamdani, if you look at it, these PCRs don't hurt at all. If you want to get yourself tested,
of course,
it's like a mosquito just biting you. That's about it. Not even that.
Yeah. So that's what I was saying.
Yeah.
You have to be trained. There are people who sort of like archaeologists,
right.
Whereas others are, it's not painful at all.
Painful at all.
So
yes.
I don't. So basically, the people who are doing self-swabbing should be trained. So how do you train them?
Yeah. So there are practical difficulties.
Yeah. No, understood.
So it is not that like the government doesn't want to give or government doesn't want to make it available. It's not that. So I mean, so if I had to run through. It should be sustainable. It's not just opening it up and then shutting it off. So that is what we're making through things.
If I may, sorry, yes, Professor, you have something you'd like to say?
Okay, just to add to what Dr. Hamdani was telling about, and now, Shamir, your question about why antigen was not made available at free use at the pharmacies. Is it due to the dollar crisis, whatever? Actually, now, I think 3 of us are involved in that committee, which has taken the decision to permit antigen use in Sri Lanka. That was in 2020, I think around September. October, when the second crisis started with the Minwangod. Yeah. So at that time, it was decided with very, very carefully selected indications, because at that time the situation was different. Everyone was admitted to the care facilities. Therefore, it didn't make a difference. Then the reason antigen was used for very carefully used indications, for example, to find out the infectivity and how it is spreading, and not really to diagnose. At that time, the diagnostic test was PCR. Antigen, there were very clear indications. However, the community use by everyone was not one of those, because at that time management was hospital based. And similarly, the other concern regarding the false negatives was there, because that would have basically self-defeated, allowing that for the overall use by anyone, free use by anyone, would have been self-defeating during that time period because the management strategies are different. And right now, in this current situation, where majority of patients are managed at home, at the same time the dengue possibility and also the influenza possibility is also there. Whatever, regardless of the antigen positive or negative, if you have symptoms, what you will be doing will not change.
So, Professor, what is the right time to do a rapid antigen, and what is the right time to do a PCR?
Yeah. Currently, I mean, most of the patients would go for antigen. No? So, if you have symptoms, for example, if you have a higher likelihood, if you have a higher likelihood of getting it positive, if you have the disease, when you have the symptoms, for example, if you have the sore throat. Now, currently, the current variant, most of the patients actually present with upper respiratory tract like symptoms, like severe sore throat and maybe rhinorrhea, sneezing, mainly sore throat. So, like again, Dr. Rajiv also very clearly mentioned. So, the right time is when you get the symptoms for the antigen. But for PCR, from the exposure, one thing is, if you have got the symptoms, you can do a PCR. Otherwise, if you are asymptomatic, after getting exposed, because there's an incubation period, no, generally the incubation period is around 5 to 6 days. So that would be the right time to get PCR done if you don't have the symptoms.
So what is the rapid PCR all about that they do at the airport, and they give the results in 40 minutes?
Yeah, I'm not really aware of the process. Dr. Hamdani, would you like to comment on?
Because when you go to countries, you can there are two private sector hospitals, and they do a rapid PCR and they give the results in 40 minutes. What is that all about?
Certain countries or certain airlines, they actually require that. Even if you have done a PCR before 48 hours, they would rather require rapid PCR at the time of entry to the airport. So this is where another mechanism where this there are two places where they do that rapid PCR testing. So it's only on the requirement basis.
No, but what is the science behind that?
It's the same. The cycles are run very rapidly, and the results have been delivered in a short run cycles. I think Dr. Rajiv knows it's a very short run cycles. You don't run it for a long time.
Dr. Hamdani, just since we are talking about PCR and antigen tests, I just want to tweak this topic a little bit on the same lines.
Okay.
Now, recently the Health Ministry published a guideline on conducting PCR tests on the deceased. They said that it was not mandatory to perform PCR tests as a post-mortem exam. The circular mentioned that, however, these PCR tests can be conducted at the discretion of the judicial medical officer. Would you be able to tell us on what grounds can the judicial medical officer confirm that a PCR test has to be conducted on the body of a deceased person?
Thank you very much for that interesting question. So it's like this. We take a person who had died at home. On a normal day-to-day scenario, what happens is you call a doctor close by to certify the death. Then you inform the coroner. Right? Then a death certificate is issued and normal burial process runs. Through this circular, the same thing happens. It's if somebody has died at home, I'm very clearly reiterating it. If somebody has died at home, the person, you can get the bodies certified through a qualified doctor telling that the person has died. They inform the coroner, get the death certificate, do the rituals. So, if a person who has died in the hospital, the clinician who's treating can give the DC or the death certificate rather, and can get the body released. Now, where this discretion of the judicial medical officer comes is, if there is any suspect, if there is any sort of fishy involvement within the death, that can be a suicide, homicide, or that can be a road traffic accident, that can be a hit, right? Or even after a road traffic accident, you get admitted to the hospital, then you get yourself tested, you are COVID positive, fine, or you're not COVID positive even, fine, then those discretions are within the liability of the judicial medical officer. Apart from that, on a normal day-to-day death, it's on the normal process.
Dr. Hamdan,
Otherwise, as you very correctly said, one might question, okay, if you say the discretion of the JMO, again the same thing.
on what grounds is the decision being made?
No, again the same thing. Anyway, you have to take the body to the JMO office. So even now it is happening. So,
Dr. Hamdani, you being a Muslim also, with regard to the burial issue, has that matter been now sorted out? Because now things have been evolving across the board over the last few years. Does Muslims still have to go to a particular location to bury their loved ones?
let me come back to this. I first stand as a Sri Lankan, so my faith and beliefs
Of course,
Islamic.
yeah.
So still, as of now, still the site of burial for national COVID-19 burial site is Uddamavadi. So as of now,
Is there discussions to change that in the future?
discussions are in the process.
Okay.
And scientific committee has met, and we see involvement of different people coming out with good suggestions.
Dr. Hamdani, when you say discussions, do you mean that discussions are underway to permit the burials of COVID-19 deceased?
So still it's in the process of discussion. So when it's in the process of discussions, you cannot say where it heads. It's in the process of discussion.
Can you provide us just an insight into what the situation
Hopefully
is
these are
at
all evolving situations, no?
Yeah, what is the
So
situation
these are all
at the burial
evolving
ground at the
situations. So
moment?
with evolving situations, we've come across so much of improvements. So hopefully things will fall in track.
As a Sri Lankan, as you mentioned before, Dr. Hamdan, do you think that the matter has to be resolved immediately to make sure at least one sect of the minority population in Sri Lanka should not be sidelined owing to COVID-19?
I think it was never sidelined on the basis because it was an evolving issue where the scientific committee sat and decided on bases and which provided guidelines on the move. But since it is daily changing, evolving kind of, even science is evolving on this. So we've looked into that matter, and hopefully the discussions will fall in track.
Dr. Hamdani, just before we move to another aspect of the discussion, let me just ask you this. Now, in December last year, you spoke to us, and at that time, we were told that currently the bodies are buried at the Majma Nagar burial ground.
Uddamavadi Sudupattina Sena.
Yes, and you told us that it can basically have about 4,000 deceased people can be buried there.
Yeah.
And at that time, we had in excess of 3,200 people already buried in that particular location. What is the situation at the moment?
3,557.
Okay. And you also said that discussions are underway to identify alternate lands in other provinces.
Exactly. So we've suggested them. They've sent 2 or 3 suggestions. One from the Kenya district and the other one is from the Putlam district. So that's what I was telling. So discussions have been taken place considering all these factors. So
Dr. Hamdani, has there been any case in Sri Lanka at the moment that individuals have not declared that they have COVID-19 when they die, not the loved ones at least, because of this matter that is prevalent at the moment?
So no, I don't think so. Because now see, as of now the rule stands is till this recent circular was released, every death has to be tested through a PCR, right?
But not anymore.
No, not anymore.
Yeah.
It was there till this circular was released.
Yeah. No, but I'm asking you during these few days.
During these few days, if it is not tested, you don't know it's positive or not.
Yeah, so they will just go and bury wherever they want.
So because there is a certified, qualified doctor who is giving the death certificate telling that this person had some disease or not.
So Muslims don't do a post-mortem. You're aware of that, Dr. Hamdani, but I don't know whether you are aware that Muslims usually don't do a post-mortem when they...
Until unless it's mandatory.
Excuse me?
Until unless it's mandatory.
Yeah.
If it is a road traffic accident, it doesn't.
In a situation like that, how do we manage this problem?
So there won't be any issue with that. So you don't need to go into a post-mortem on this.
So the PCR test.
So let me be very simply explaining you this. What you are asking, after the circular was released.
Yeah. Was there any instances in which
where people had been tested positive and who had been hiding this?
And who have been buried as a result of that in a normal burial ground which is allocated for Muslims.
Exactly. Once a person is dead, the doctor has to certify that, no, Shamir? So if the person dies at home, there should be a qualified doctor certifies that the person had died
As a result of a heart attack
or whatever, right? Then he has to inform the coroner. So that person cannot be a person who had been tested positive and isolated at home. If that is so, that is a COVID death.
But then again, doctor, there are now asymptomatic cases also.
Right?
Asymptomatic
Did you get me,
cases.
Shamir, on that?
Yeah, no, I totally understand.
Yeah.
For the benefit of the people who are watching the show tonight,
Exactly.
Dr. Hamdani.
Yeah.
So what about asymptomatic patients, as
So
Hassan
whether you are
mentioned?
asymptomatic or you're symptomatic, you are a COVID positive patient. No?
Now, how would you know? If you're asymptomatic, you would know. If you've not done the rapid antigen test or PCR, you would know whether you're COVID positive or not.
Then until unless you are tested, there is no mechanism of finding out. No.
So then again, there is a possibility that a COVID-19 deceased
Yeah.
may be buried in
No,
other
You
no,
can't
parts of
say
the
a COVID-19 deceased if
A
you're
person- okay, let's
if
put
you're
it
not
this way.
tested,
Yeah.
you're not proven as COVID-19.
Okay, right. Anyway, let's go out from the discussion because it's important to talk about. Yes, of course. Yeah, I have a question from
Yes,
one of
sure,
our
sure.
viewers. So, Dr. Rajiv, we have a question from one of our viewers. The question is: my husband is a cancer patient, and we have to go to meet the doctor almost every week. But before going to the ward, we have to do a rapid antigen test. And this is totally understandable and there is no question about that. My husband, who isolates himself at home because his immunity level is very low, is exposed to so many people at the place where the rapid antigen test is done. Does that pose a risk to my husband or those people who are around him?
Well, if he wears a mask
Okay.
and takes all the precautions, then probably the chance of him contracting the disease is minimal. However, if for example there are other people around with their masks off while the antigen test is being done, then probably there is a risk. So, I mean, you can never say zero, because our cousin of mine who's a surgeon, he is probably the most careful person I know when it comes to COVID. I mean, basically, I think he uses a spacesuit. I mean, almost a spacesuit.
Almost a spacesuit.
Yeah, but he got COVID. So, how he got it, we don't know. So, you can never say, you cannot say 100%, you can't give a 100% guarantee.
Yeah, the social stigma, Professor Indika, initially it was very vivid. People who have been infected with COVID-19 were sidelined as a social stigma. Is that situation still prevalent as we speak in the rural areas? I'm sure it's not in the urban areas of Sri Lanka, but at least in the rural areas of Sri Lanka, where you sideline a person completely just because he or she has tested positive for COVID? Or have we moved out of that notion now?
I mean, we don't have any kind of research evidence or data on that. I mean, if we are speaking about based on the information that we get, or maybe based on course that we get from the patient, my guess is that we are moving out of that notion, because it is becoming more and more common. Almost everyone has got COVID. It's something like that, the current situation.
Right.
And also the previous, it was very much linked with the compulsory admission and quarantine during that time period. I suppose, again, I'm not criticizing that decision, because at that time period it was a needed decision. But right now it's not needed. So now the situations have changed. It has become more patient friendly. Even the isolation period or the quarantine period, it has been more relaxed.
There was a time, Professor Indika, when someone was tested positive with COVID, that a doctor would call the person who has been tested positive, consult about his not only his physical well-being, but also the mental well-being of the person as well, to make sure that the person was okay. This was very aggressively practiced in Sri Lanka for a prolonged period of time. With the new regulations coming into play, where it's only been restricted to 7 days, does such a mechanism still exist?
You mean
to check on the well-being, not only the physical well-being, but also the mental well-being of patients?
It is there. It is part of the home-based management system.
Right.
And also the other mechanism is the patient can call back. That possibility is also there. That is more with the 247 service. Both possibilities are there. And what you have mentioned is actually very important. The psychological impact is very important. And also beyond 7 days, even though the regulation says after 7 days, that you can basically go back to work, so on and so forth. That is correct for most, true. But there may be some who might have symptoms beyond that. And there may be another group actually, especially those who haven't completed vaccination, or those who haven't basically followed the basic measures during the early part of the illness, neglected the disease and basically heavily exerted them, or have taken different other medications. They are more likelihood of getting another condition called post-COVID. So and that is very common.
That's a very important point, Professor, that we are coming into. So I want to direct my attention to Dr. Hamdani. Dr. Hamdani, from the amount of individuals who are being tested positive day in and day out, and who are reported to get severe diseases or even death, the tragedy itself is about losing your loved ones. So in a situation like that, has the Ministry of Health been able to ascertain as to the number of deaths looming from which sector? Are these individuals who are having comorbidities before, or are these individuals vaccinated, at least got the booster shot? Have you all done a study on this? Do you all have research data available with regard to the number of deaths and the individuals who are dying on which premise?
Yes. Of course, like Shamir, as of now we are experiencing about 1,200 to 300 cases now, daily.
Right.
And cases are running on a plateau.
Right.
And about 25 to 30 deaths. Right. So out of these 30 deaths, you take roughly about 75% who had not got completely vaccinated. I mean, a full complete vaccination means getting all 3 doses.
Then again, second, and the booster shot.
And the booster. Then again, one might stand a question, which I have been posted by a lot of intellects also. Okay, if it is 75%, 25% has anyway got it, no? And still they have died. One can obviously come out with that question. Yeah, obviously. So when you elaborately or elucidately break down that, out of that 25%, it's more than 18% are in the form of having comorbidities.
Even the recent deaths that were reported between the ages of 20 and 30 as well.
Yes, of course, yes. Having comorbidities. If at all it's pure, it's going to be about who have got the 3 doses and died, and with comorbidities, that's also with comorbidities, it's going to be about 5 to 6%.
5 to 6%?
Maximum. So, majority of them had not got the vaccine, not completely vaccinated. So, this is actually an alarming sign for all of us. Like, one should understand why this is important. Like Dr. Rajiv very well said, vaccination does not prevent you from, taking off all the protective measures, all the health protocols. No. But still, it will prevent you from getting into, bad scenarios, losing your loved ones. It will prevent those things.
And this is especially Dr. Hamdani with regard to the elderly population.
Exactly, above 60 population.
60, like if your parents who are above 60 years old, and if you think they are not going out, and they should not be vaccinated, that is not the mentality that you should have.
Because you are going out and coming.
You are going out and coming. As a result, you have to make sure that even your parents at home should be forced to have the vaccine, the third dose, right?
Exactly.
Dr. Hamdani?
Yeah, exactly. That is why we made this mobile vaccination, campings also now. So we give mobile services.
Which is actually a question I want to raise.
Which
accessibility to vaccines. When you look at the distribution of vaccinations so far, we see some parts of the country where the numbers are very low. So the question you have is particularly in rural communities. Where do they go? Are these mobile units reaching them? If so, who do they talk to? How do they get the vaccine? Is it easy? Is it challenging in some parts of the country?
Exactly. So let me start like this. For about 1.5 months of a period, now we've been collecting all information from corporate sector, let that be government institutions, private institutions, any of the institutions, they can easily inform us. So we'll be arranging teams and deploying teams to their end, which we've been doing to all the centers, most of the centers by now, most of the government institutions also, along with the Colombo GA. Likewise, the regional ends were also notified. They were getting along with their GAs and getting with all the district secretariats, getting information, because those are the people, the Gram Nilidhari is the most grounded person in the village who would know all the information of the population. So they would get the information, send us. So we will collect the people around and we'll place stations and we go into people and get them self-jabbed. That is how this 31% was increased to 46% over about 10 days.
If somebody has a question, doctor, is there a number they can call?
Yes.
And will it be answered?
Yes, of course. The number would be on a vaccination, mobile vaccination call. 077 077 413128.
One more time, please.
077 yes 077 413128, or else I'll give you the other number.
There's one number missing.
0776. Give me
do you want to double check it, Dr. Hamdani?
Yeah.
While we're waiting, if I can ask a question from...
Yeah. 077. Yes. The other number is 121 4131.
Okay.
You can call this number right now even.
Okay.
And ask them, you have a team, you are from this corporate sector, you want a mobile vaccination team, you are having this number of people, so how can we arrange it?
Okay. But that's possible.
That's possible. We were doing.
What's the number again?
077
077
121
121
4131.
Okay.
Thank you, doctor.
077 121 4131.
I have to ask this question, that's why I'm coming to Dr. De Silva. In fact, it's a question from one of our viewers. It's about vaccinating children. We've already discussed that this COVID is a developing science. So now, what is the latest science when it comes to vaccinating children, and what has Sri Lanka, what regulations have been implemented? I know that children are allowed to have one vaccine. What about children under the age of 12? Could you tell us, doctor?
Yeah, so there was a committee appointed by the Sri Lanka College of Pediatricians. I was also one of the members, so we have given our recommendations to the Director General of Health Services. So now it will probably go through the Advisory Committee on Communicable Diseases. So basically in the United States and in the US and in the UK, I mean basically we generally follow the guidelines of the UK. I suppose it's traditional. So for people for children from 12 to 15, you give 2 doses, 12 weeks apart. Children with comorbidities, certain comorbidities, are given 3 doses, 8 weeks apart. Now in the children from 5 to 11, you give children who have comorbidities. Once again, what we said, plus children who live with people who have comorbidities, you give 2 doses, 12 weeks apart. So there is a place for vaccinating children from 5 to 12 years. So at the moment, we have not taken a decision on the 5 to 12, but we have taken a decision, 5 to 11, but we have taken that is, this particular committee has taken a decision on children from 12 to 15. But that has not been accepted just yet. Probably it will be accepted. So I can't tell you what we said at the moment, but basically I think there will be some changes.
So Dr. Hamdani, is there any discussions afloat right now with regard to giving children between the ages of 5 and 11? Because
This is
most
exactly
often
what
than not,
Dr. Rajiv.
they bring the vaccination. Sorry, they bring the virus to the home as well, because now schools are open.
This is what exactly Dr. Rajiv was telling. Like, it has been in the process of discussion, and so it will be decided very soon.
So Dr. Rajiv also mentioned, Dr. Hamdani, that it's important individuals with comorbidities and who has low immunity, like individuals with renal failure, individuals with cancer, so on and so forth, should be considered to be given a 4th dose.
He was suggesting that, so that has been also posted into the technical committee.
Right.
So these decisions are not made by any of these individuals or any one of us here.
Right.
It's a committee which decides, looking at the benefit to the majority. So that is how usually we make it. So these things have been actually discussed in the technical committee, and which has been tabled also.
So let's say, Dr. Hamdan, there was discussions that if there was a country that someone is going to, and if that country in question requires a 4th dose, that is being facilitated by the Sri Lankan Health
Yeah, they
Ministry.
can actually write to the Director General of Health Services requesting their need, proving their documentation, and the request from that particular end, which is mandatory for them to have it.
From that particular country. Of origin or
country of arrival, country of arrival, and the institution of arrival, because certain countries, not that every country needs it, but certain institutions, they need it.
Okay.
So mostly this question was,
might be an opportunity for individuals in the back door to get the 4th booster also.
of course, but they'll have to provide documentation.
This
Proper-
time is going to be very steadfast.
Very steadfast and very stringent on that. Like, so they'll have to provide valid documentation,
I hope so.
which will be sent to Director General of Health Services. So he'll pass it on to me. So it is with that only we'll be able to allow them.
Right. So, Professor Indika, we've spoken a lot about battling COVID-19. Would there be a threat of a lockdown if the remaining 54% don't come for the vaccination of their 3rd shot in Sri Lanka?
Yeah, again a very difficult question, but if you consider so many factors, because there are many factors coming into play, I mean, maybe the current economic situation and everything together, there's the possibility of lockdown, I suppose, is very low, but the decision is at a different level. Also, having said that, with the current situation, lockdown may not be the answer also, the way it's spreading at the moment. And I think the way that we have to go is to empower the general public. At the moment, empower the general public on what to do. So the way forward would be vaccination definitely, and also empower the general public on what to do to prevent, and also what to do if you get the disease. If we can do that, I think that could be the way forward, because, I mean, personally speaking, with the current situation, I don't think lockdown as an answer.
Lockdown is not the answer for anything right now, Professor.
No.
Not even for the country economically as well. We are not in a situation to face another lockdown, unfortunately.
Not in a position.
With the current economic crisis looming in Sri Lanka, and also what is prevalent with regard to power cuts and all that, that's another headache that the people want in their plate at the moment. Having said that, we're going for a short commercial break. Stay connected, stay with Face the Nation. We'll be right back with the final round on our discussion today, revolving around battling COVID-19 is concerned, with 3 eminent doctors, Dr. Anwar Hamdani, Dr. Rajiv De Silva, as well as Professor Indika Karunatilaka. Stay connected, stay with Face the Nation. We will be right back.
COVID-19 සඳහා ආරක්ෂිත පියවර ජනයා වැඩි වශයෙන් සිටින ස්ථානයන්හි ගැවසීම මගහරින්න. රෝගය ආසාදිත පුද්ගලයන් හමුවීමට නොයන්න. මුහුණ, මුඛය, නාසය සහ ඇස් ඇල්ලීමෙන් වළකින්න. අනවශ්‍ය ගමන් බිමන් යෑමෙන් වළකින්න. මුඛාවරණය ඉදිරිපස ඇල්ලීමෙන් වළකින්න.
තනිව යන්න බෑයි කියන කාරණේද අධ්‍යාපනයේදී මම කියන්නේ ප්‍රධාන වශයෙන් සිදු වෙන දේ.
අපිට රුසියානු සපත්තුව මේ ලංකාවට දාන්න බෑ, ඒක ලොකුයි. චීන සපත්තුව සීන සමාජවාදී ඒකත් හරියන්නේ නැහැ. ඒක මේ කකුලට පොඩි. අපි අපේම සපත්තුව මහ ගන්න ඕනේ කියලා.
එක්සත් ජාතීන්ගේ මානව හිමිකම් කවුන්සිලය කියලා කියන්නේ මානව හිමිකම් පිළිබඳව ලෝක පාර්ලිමේන්තුව.
අපි පරිසරය ගැන දෙකක් තිබුණා.
මම ඉස්කෝලේ යන කාලෙත් මේක තුන්වන ලෝකේ රටක්. දැන් මම මැරෙන්න යන කාලෙදි තුන්වන ලෝකේ රටක්.
ආණ්ඩුව රූපාන්තරණය වෙනවා රාජ්‍ය බවට.
එත දෙක එත පහේදී තමයි මේ වතු ඔක්කොම නැෂනලයිස් කරේ.
එහෙමයි ධර්මශ්‍රී, රට ගැන විතරක් නෙමෙයි මම ගැනත් මම බය වෙලා ඉන්නේ.
අපනයන කවුද කරන්නේ? කවුද විශ්වවිද්‍යාලයට ගියද? කවුද අපේ ව්‍යාපාර කරන්නේ? විශ්වවිද්‍යාලයට ගියද?
A brand new year, a year of hope, a year of aspirations and people looking for inspiration.
Our software engineers, our IT expertise are, not seconding to anyone.
A proper investigation led by the CID. This will be swept under the carpet.
Understanding about the stock market, the fundamentals, the economy, that is very important.
Entire ownership of this reclaimed land as well as the governance of Port City are all under the government of Sri Lanka.
No planet, no people, no business.
Yes.
And this is the simple thing about Biznomics.
Your weekend's most profitable 60 minutes. Biznomics. Saturday and Sunday at 5 p.m.
Welcome back. This is Face the Nation. We start off the final round with Professor Indika Karunatilaka, Secretary General of the Asia Pacific Academic Consortium for Public Health and also former President of the Sri Lanka Medical Association. The time starts now. What is the way forward for Sri Lanka?
Yes, I would like to give a simple message. Yeah, it's very clear that we have to take the booster. We have to reach the target. And secondly, we have to empower the general public on what to do. Again, I would like to give simple advices. If you have symptoms that are suggestive of COVID, please get tested if possible. Please get medical advice. Please have a good rest. That could be life-saving. Have a good rest. Have good hydration. At least 1.5 to 2 liters of fluid. And if you have symptoms like sore throat, simple things like salt water gargling and maybe warm sips of fluids would help. If you have fever, you can get paracetamol. Nowadays, children get high fever. Again, generally nothing to alarm. If you manage well, within 48 hours, generally most of them are fine. And if you have other symptoms, again you can go for symptomatic management. Please don't go for antibiotics and other drugs that are not proven, because they will do lot of harm. We see a lot of misuse of antibiotics like azithromycin and maybe high-end antibiotics, misuse very much at all levels. It will not have any use for a viral disease. If at all, it would cause maybe side effects, maybe dangerous interactions, and maybe the bacterial resistance later. So, not a good practice at all. If you need antibiotics, you are not in a position to stay at home in COVID. So, stick to those. And if you have any symptoms like difficulty in breathing, chest pain, or continuous fever, seek urgent medical advice. The 247 and several helplines, they are there, and everyone want to help you. So, make use of the help available, make use of the vaccine facility available. I think with the empowerment, we can move forward. Thank you.
Professor, very quickly, You spoke about antibiotics. What about vitamins? Individuals are now taking vitamin C rapidly, vitamin D rapidly. Is there any message on these kind of medications or vitamins as well, or supplementary medications?
Actually, I mean, at the moment, there is no conclusive evidence on the effectiveness of any of those. I mean, vitamin C, sometimes there is a tendency to take high doses. Sometimes there can be maybe psychological impact or something like that. But research data haven't shown any conclusive evidence related to any of those. So, I mean, if you want to take it for psychological impact, that may be one story, but definitely it won't cure you. It won't cure you.
So there are no medicines available to boost your immunity.
Okay, I would tell that. Okay, the best medicine is actually within your body. For most, the immunity within your body, that is basically enhanced by the vaccination, that is capable enough to take care of this virus. That's why we advise take a good rest, good hydration, good nutrition, then the immune system will take care of that. And don't upset the immune system by taking drugs like steroids, which should basically reduce the immunity. So allow your body to heal and just facilitate.
Thank you very much.
And if you have risk factors, be alert, then seek medical attention immediately.
Thank you very much, Professor Indi Karunathilaka. We now move our attention to Dr. Anwar Hamdani, Chief Coordinator of COVID-19 at the Ministry of Health, Director of Medical Technology Services. The time starts now.
Yeah, thank you, Shamir. Like as Professor Indika very well mentioned, like you were actually asking about the fourth dose. Like before going to that, at least like as of now, we've only covered about 6.4 million of people out of the eligible population who had taken the second dose, or roughly about 46%. So why not we reach that 46% into 80-90%? Because most of the countries which have left off or which has opened up gradually or which has opened up freely enough, they've reached up to that level. So that's how people think on, because it's you'll have to live with this, as Professor Rajiv very well told. You'll have to live with this for the time of another couple of years more at least. So to live with this, you can't be halting all your operations. You can't be halting all your day-to-day activities. Your children have to go to school. You'll have to go to work. You'll have to go to religious places. You'll have to do your religious rituals. Do everything all around. For that, you need the freedom of what you feel right now. What you're experiencing. You're coming to work, going back, doing shopping, going to restaurants, having food, having dinner, coming back. All this, what we are experiencing is the leverage of the successful vaccination program which we had done some time back. So it is our duty as responsible individuals, responsible citizens, to give our best to the nation. So this is one of the chances you're getting. So do your citizen responsibility, individual responsibility, get yourself jabbed. By that you are not only saving yourself, you're saving your loved ones, the society and the country.
Thank you very much, Dr. Hamdani. But before we go, just one quick question. I promised to not ask questions in the final round, but because I posed questions to Professor Indika as well, I thought I should not let you go as well. I need to pose a question to you as well. With regard to the shelf life of the Pfizer vaccines that we have, when is it expiring? The shelf life of the Pfizer vaccines that we have,
it's end of July.
End of July. So we have to have a very aggressive plan to diminish the stocks that we have at the moment.
There are two stocks actually. One is actually ending as end of July. There is some more coming. Another lot which will be ending up in 2023, early 2023.
How much did we purchase these vaccines for, Dr. Hamdan?
Sorry?
How much did we purchase one of these vaccines?
So actually, I do not know the exact amount because it was purchased through the SPC, State Pharmaceutical Corporation. So I'll have to
just
revert
hope
back on that.
The people will utilize this opportunity which has been spent by the government on behalf of the people to go and get the third dose in the near future. Our advice to you is also, just as the medical professionals mentioned, go out there, everything is available, get yourself vaccinated. We end the show tonight, last but not all the least, with Dr. Rajiv De Silva, spokesperson of the Association of Medical Specialists.
Thank you. Now, COVID is going to stay for some time. That's number one. Secondly, the vaccines that we have been given, the immunity does not last forever. It will go down, and it is going down. So therefore, there is a need to boost this immunity. And definitely, there is evidence to say that a third dose helps in preventing infection, but more importantly, preventing hospitalization and death. So there is no question that people should take the booster. Now, it is also very important that people listen to science and not to pseudoscience. When it comes to vaccines, people are listening to pseudoscience, right? There are certain influential people without any scientific background who say, for example, that the Pfizer vaccine induces sterility and that the Pfizer vaccine causes mutations. Now, all these are rubbish. I mean, I have to say this, it is rubbish. There is no such evidence. So, if you want to take advice about vaccines, listen to the scientists and listen to the evidence, because otherwise it is you and your loved ones who will have to pay when you get the infection and when you lose people close to you. Please take the booster.
In a situation like this, Dr. Rajiv, I can't let go of you as well. I'm going to pose a question to you for good measure. What is the message you have for the government, Dr. Rajiv?
Well, as far as the vaccines are concerned, I think use scientific evidence when immunizing people, and try to give the correct information to people, and also to try and persuade people to take the vaccine, and get people who are knowledgeable and who are accepted by the general community to give that message to the people to take this vaccine.
Thank you very much, Dr. Rajiv Dissil, for joining us this evening on the show. Professor Indi Karunatilaka, former president of the Sri Lanka Medical Association. Thank you very much, Professor, for joining us this evening on Face the Nation. He's also the Secretary General of the Asia Pacific Academic Consortium for Public Health. Dr. Rajiv Dissilva, spokesperson of the Association of Medical Specialists. Dr. Anwar Hamdani, Chief Coordinator of COVID-19 at the Ministry of Health, Director of Medical Technology Services. Thank you very much, Hassan. Thank you very much, Shehan, for joining us this evening on Face the Nation. You for a minute thought that I forgot your name, right, Shehan? No, I wouldn't do that. Not to you, for sure. So having said that, some takeaways as far as today's discussion was concerned. The vaccination is freely available. If your organization or any individual wants the third shot for their organizations, respective organizations, the number to call is 077 121 4131. Let me spell out the number once again. It's 077 121 4131. And if you want to get yourself tested, those in Colombo could do so by going to Campbell Park in Colombo between the time 9 a.m. and 2 p.m. and get a rapid antigen test done as well. That is based on what Dr. Hamdani said. So you can always go out there, get yourself tested. The better is to get the vaccination on your lap. So having said that, please be safe, maintain social distancing, wear the mask, wash your hands as much as possible, and ensure that you remain not only just a citizen, but a responsible citizen. Having said that, I leave you tonight with a quote, as I always do. Good health is not something we can buy. However, it can be an extremely valuable savings account. Take care and good night.